Please, can I get confirmation that we can all see the poll? I see that people have filled the poll. So please, for those that are here to fill the poll, please kindly fill the poll. It won't take a whole lot of your time. So we are now at 11:10. Good morning once again, everyone. My name is Omotayo Akimumi. I am the Business and Project Support Officer here at the Lagos State Employment Trust Fund. And today we'll be speaking on accessing affordable healthcare in Lagos State via the ILERA scheme. But just before we start, here at the Lagos State Employment Trust Fund, I'll be taking you through what we do here at the Lagos State Employment Trust Fund. So here at the Lagos State Employment Trust Fund, came into being through the Lagos State Employment Trust Fund law of 2016. And one of the aim of setting up the Lagos State Employment Trust Fund was to help reduce the issue of unemployment in Lagos State. Now you might ask, can we go about doing that? Now we go about doing that through our various programs, namely our flagship program, which is the loan program, where we give access to finance to business owners here in Lagos State. Now we have them in three different categories, namely the MES, which is a micro enterprise startup, the ME, which is a micro enterprise, and the SME, which is a small and medium scale enterprise. So under these three different categories, if you fall under the micro enterprise startup, now that means you've acquired a skill, a vocational skill, and you need the funding to, start up your own business. You have the opportunity to have access to between 50,000 to 250,000. And if you fall under the micro enterprise, that means you've been running your business for quite a while and you'd like to have access to our loan facilities, you can have access to between 50,000 to 500,000. Now, if you have your business registered under the CAC, either as a business name or as an enterprise, you can, or as a limited liability company, you can have access to between 501,000 to 5 million naira. Now you might ask, what is the interest rate? Now we operate a single digit interest rate, which is 9% per annum. That is, for example, if you acquire like 100,000, if you acquire like 100,000, you can get the interest rate on the 100,000 will be 9,000 naira. That means you'll be paying back 109,000 divided by 12. That is what you'll be paying back monthly. So that is so we run a 9% interest rate per annum. So that's our interest rate. But if you fall under the MES, you'll be paying back within a year. If you fall under the SME, you'll be paying back between 18 to 24 months. So these are the different loan categories that we have on offer. Now you might ask, how can I have access to this? You can walk into any local government close to you because we are situated at all the 20 local governments here in Lagos State. You can walk into any of the local governments close to you. We have offices there. We have our officers that will be on ground to attend to you. Now you might ask, what are the criteria or what are the documentations that I need? You'll be needing your LASTRA, you'll be needing your tax, you'll be needing your BBN, your ATM, your passport photograph, and your government recognized ID. So these are the documentations that you'll be needing. But if you'll be applying under this SME loan, you also need, in addition to documents I've mentioned, your CAC. Now, aside from our loan programs, we also have the different programs at the Business and Project Support Unit, such as our capacity building programs where this particular masterclass falls under. We have our masterclasses and our advisory sessions that we bring to you weekly at the Business and Project Support Unit. We also have our access to market opportunity that we bring to you. We'll be having one starting on Monday. Please be on the lookout for the application to apply for business owners that would like to exhibit. We also have one coming up next month, which is strictly the LSC themed access to market opportunity. So please follow us on all our social media platforms at Lagos State Employment Trust Fund. We're on Instagram, we're on LinkedIn, we're on Facebook, we're on X. So you can follow us on all of these social media platforms. And turn on your post notifications so that when opportunities like this are available, you do not miss out on it. Now, aside from our business and project support programs, of which we also have our fashion hub, where those that are in the fashion space can get the opportunity to, you are in a fashion space, don't have access to probably a space to work. We have our fashion hub where you can walk into and pay a token so that you can have the opportunity to use the facilities there. Every facility that you need as a fashion designer is available at this fashion hub. Now, aside from all of this program, we also have our employability units that are in charge of everything that has to do with trainings. So if you are within the ages of 18 to 35, you'd like to acquire a skill in construction, in beauty, in fashion, and HVAC repair and the likes, we have our employability unit who are strictly in charge of that. We also have our we also have um we also have our Lagos Innovate units, where for those that are in the tech space, you like to acquire a workspace voucher, you have budding ideas that you like to bring to life, you're a female founder. These are various opportunities. There are various opportunities for you on offer at under the Lagos Innovate team. So please, you can follow us on our social media platform at Lagos State Employment Trust Fund. Our officers will be on ground to attend to you and to help you. Now, I can see a question in the chat box asking if we cater to people with disabilities. Yes, we do. Um, Sometime last year, we had a partnership where we catered to people living with disabilities, in training them in different skills like fashion, like barbing. So we have different skills that we have on offer. We are very inclusive. We try to be inclusive with all of our programs. So we have programs that cater to people with disabilities. So if you're interested, just like I said, please follow us on all our social media platforms, turn on your post notifications so that when programs like this come into, when programs like these are available, you do not miss out. You don't want to miss out on any of the programs that we have on offer for you here at Lagos State Development Trust Fund, because what we aim to do is to provide access to opportunities for business owners, for Lagosians, for Lagos residents. So notice I said Lagos resident. Now you don't have to come from Lagos you don't have to be an indigene of Lagos to benefit from the Lagos State Employment Trust Fund. As long as you're resident in Lagos and as long as you reside here in Lagos, you can have access to benefit from everything that has to do with the Lagos State Employment Trust Fund. Now we have here with us Mr. Olusegun Braimo, and Mr. Olusegun Braimo will be taking us through today's session. So Olusegun Braimo is the Cluster Manager, Lagos West Senatorial District for the Lagos State Health Management Agency, and he'll be taking us through everything that has to do with accessing affordable healthcare in Lagos State. Mr. Olusegun, please, you can go ahead and take the floor. Thank you.
Good morning once again. I believe you can all hear me. It's a pleasure to be here.
Yes, we can hear you, Mr.
Thank you.
Olusegun.
It's a pleasure to be here, and I will not take much of our time because I anticipate I might have a few questions to ask at the end of my presentation, and then we'll have enough time for that. But yes, you'll bear with me for a little while. I'm trying to share my screen, but it's giving me some challenges, and that's the major issue I'm having right now. Just bear with me. So while I'm still waiting for it to come up, I don't know if it's a network issue or if it's just an integration issue. I'll just go ahead with it. So the reason why we're here is to know more about accessing affordable healthcare in Lagos State. First of all, I'll give a brief introduction of what the agency is for and what ILERA is. So the Lagos State Health Management Agency was brought about by the LSHS law, that's the Lagos State Health Scheme Law, which was enacted in 2015. And the law basically gave birth to three things, which is itself, which is a mandatory health insurance program that ensures that all residents of Lagos State have access to quality and affordable healthcare. The law also birthed LASHMA, which is the Lagos State Health Management Agency. And the agency is charged with the responsibility of ensuring the effective implementation of the LSHS law. And lastly, give it to the Lagos State Health Fund, which is an independent fund and risk pool where all health insurance premiums are stored and warehoused and managed and ring-fenced by law by the Lagos State Health Management Agency. Now, the objectives scheme is it's basically on their working hours in Lagos. So if you spend most of your business time in Lagos, meaning you live outside Lagos or you work in Lagos, then you are by default entitled to benefit from ILERA EKO. Also, it is aimed at protecting families from financial hardship of huge medical bills. As it is today, paying out of pocket for medical bills is not something to encourage. And that is one of the bridges that ILERA is trying to create. It also limits the rise in the cost of huge medical bills. This is through equitable distribution of funds across all areas. And lastly, it is to maintain the high standard of care delivery service within the scheme. Remember, I said that one of the goals of LASHMA is to ensure the effective implementation of the LSHS law. And by doing that, it also serves as a regulatory arm for healthcare providers, ensuring that they deliver quality healthcare, which is the two pillars that the Lagos State Health Scheme is resting on. Now, the Lagos State Health Scheme has a product. The product is called the ILERA EKO. So LASHMA is an agency, and LASHMA has three arms. And one of the arms of LASHMA is ILERA EKO. The other arm is the FOSHA arm, which is responsible for registering and enrolling vulnerable residents of the state. That is those who cannot pay for health insurance for themselves, which the state has made provisions. And then the regulatory arm, which is ensuring compliance with the LSHS law. But the ILERA EKO arm is all we're focusing on today. The ILERA EKO arm is the social health insurance arm of the agency. Now, ILERA EKO has 5 different products I'll be focusing on, but we'll draw more on 3 of them. The first one being the standard JARA plan, second one being the standard JARA plus plan, and then we have the seniors plan. Other plans that we have include the student plan, which is for primary and secondary schools. We also have the high institution plan, which is for tertiary institutions. We also have the diaspora plans, which is both Home Connect and Wakanal plan, which can be bought by people in diaspora for their relatives here, or can be bought as a travel plan, meaning people can have it when they're around and pay for it in foreign currencies or even when they're out of the state. Please, I want to believe that we can still all hear me, but if we have any questions, please let's note it down so that when we get to time for question and answer, we can take it all together. Oh yeah, I saw someone just dropped a message that they cannot see my slide. Yes, I'm trying to open it, but it's giving me some challenges. It keeps giving this error. It's not showing on the screen. I'm just reading it. But I don't want to spend all the time trying to just share my screen. That's why I'm still giving the presentation. But there is a slide that I have, and it's open right now on my system. So if I may continue, I will go over what the standard JARA plan is. Once it comes up, we'll pick it up from there. I'll just go over what the standard JARA plan is. The standard JARA plan is the basic plan of the Lagos State Health Management Agency. It's the basic plan, meaning it's the most affordable plan, and it's the one with the least premium. The benefits of the standard JARA plan can be categorized into 3, which is the primary care, secondary care, and the tertiary care. Primary, the secondary, and the tertiary care. Now, the primary care focuses more on the day-to-day things that every resident of Lagos goes through. We're talking about access to general consultation. We're talking about access to specialist consultation. It also involves treatment and management of common ailments like malaria, acute or complicated febrile illnesses, diarrhea, acute respiratory infection, uncomplicated pneumonia, and so on. It also covers follow-up treatment of chronic illnesses like hypertension, diabetes mellitus, sickle cell anemia, asthma, arthritis, and so on. I think at this point, I would like to take a minute also. I can ensure that my slide is showing to make this presentation a bit more smooth. Please just give me 2 minutes, please.
Apologies, Mr. Olusegun, we suddenly can't hear you anymore.
Yes, I'm trying to share my screen again. I think it should be coming up now.
Okay, it's up now.
Okay.
But if you can kindly, okay, yeah.
Can we see my screen?
Yes, we can. But we're waiting for it to be on slideshow. Yes, it's fine. We can see it clearly now.
Okay. Okay, thank you very much. So as I was saying, the standard Java plan, which is our basic plan, covers, well, I'm going to divide it into three so we can make it faster so that we can actually talk about the other plans. So the primary care starts from the general registration of the facilities, general consultation with all the vital checks upon going to the hospital, which include blood pressure, weight, temperature checks, height, and so on. It also covers health education. Now, for specialist care under the standard Java plan, it covers 9 different specialists, including physiotherapy with up to 5 sessions within the policy year. But to see the specialist, you're only entitled to 4 visits within this policy year. Now, just a brief thing so we can understand. Policy year is different from calendar year. Policy year is 12 months from the month your policy becomes active. Okay, we're in June right now. This is June 26th. Let's say you've registered for ILERA this month and your policy becomes active in July. Your policy year starts counting from July and would expire in June 2027. So if we say 4 visits, it means 4 visits within the policy year. And if we're talking annually on the lyrical plan, it's policy year, not calendar year. So 9 different specialists are covered under the standard general plan with up to 4 visits within the policy year. The common ailments also covered includes outpatient care for common ailments like malaria, acute and uncomplicated febrile illnesses, diarrhea, acute respiratory infection, and so on. All also covered for chronic illnesses like hypertension, diabetes, sickle cell, asthma, osteoarthritis, and so on. Childhood illnesses are covered as follows: feeding problem and nutritional counseling. Basically, what children go through within the ages 0 to 5 and even preteens. Now, child welfare services are covered in accordance with the standard practice, which is nutritional advice, good monitoring, as well as immunization for children under 5. Now we're going to be talking about the secondary care, meaning these are things that not everybody gets to access, but it's available for those who need it. Now for eye care, it covers treatment of minor eye ailments, including conjunctivitis, parasitic and allergic ailments, meaning people that just develop redness of the eye, removal of foreign bodies from the eye. It also covers glasses with a limit of 10,000 naira. This means that if you are to get refraction lens and frame, that's for the lens and the frame at your chosen hospital, it will cover 10,000 naira, while they already will pay the differential if it exceeds. But most times, your advice are really just go with your frame, so you have your own choice, and then the lens usually doesn't go beyond this amount. But if it does, this is what you will cover, and then you can pay the differential. but it covers two surgeries under eye care, which is pterygium surgery as well as cataract extraction surgery. Family planning services that are covered under the standard general plan go from counseling to provision of contraceptives, both oral and emergency contraceptives. Now, hospital care is limited to 15 days and is accessible in the general or standard ward depending on the definition by the facility. And while in the hospital, you're at least covered for 1 meal per day, not 3 meals per day, just 1 meal per day. It could be in the morning, in the afternoon, or anytime the hospital provides meal, but it's 1 meal per day. Request by an enrollee to access admission outside the general or the standard ward might require the enrollee to pay out of pocket for such services. What ILERA covers for the standard general plan is access to admission in the standard or the general ward. Now, pharmaceutical care is accessible through our network of community pharmacies that ILERA has partnered with. Currently, we have a little over 400 pharmacies that enrollees can access on the scheme. And for pharmaceutical care, it's not a case of going to the pharmacy to just say, oh, I'm feeling this way, I need this drug. You have to have gone to the hospital, must have been consulted, and you must have been diagnosed. And upon getting the prescription from the facility, then they really can proceed to the community, getting prescription from the hospital, then they really can proceed to the community pharmacy to get their prescribed drugs. However, it is good to note that there are drugs that are not covered on the scheme. And for these drugs, they only will have to pay out of pocket. But before any payment is made, they would have to speak with the customer care of ILERA to be sure that the drugs are truly not covered. Now, for the chronic illnesses that are covered under the scheme, diabetes, hypertension, and asthma are the major focus. However, periodic routine investigation as well as monthly drug refill is only available for diabetes and hypertension. And this covers both those who are just discovering it or those who have pre-existing health conditions, meaning those who already have these chronic illnesses and they know it. ILERA also covers blood transfusion, but it's limited to 2 pints of blood per year, meaning when transfusion is needed, ILERA covers up to 2 pints of blood, as well as donor screening, meaning if you're donating blood for someone, either in a maternal care or just someone who needs transfusion, then you won't have to pay for the screening of the blood. HIV services are covered provider-initiated tests based on clinical guidelines, meaning if you go for to see a doctor and based on their consultation, they can request that you do an HIV test. And so if found positive, you'll be referred to HIV referral centers for further treatment. Also, an enrollee can request for once a year to know their HIV status. This has got to do with clinical guidelines, meaning you can walk into the hospital under ILERA and say, oh, I want to know my HIV status, and the test will be carried out, and you won't have to pay. For tuberculosis services, what is covered on the standard general plan is sputum AFB for tuberculosis, referral linkages, and then TB service charges, which covers consultation, counseling, and dispensing of drugs. In a summary, ILERA covers the full blood work, which covers blood count, ESR Western green, malaria parasite, genotype, rhesus factor, and so on. And then under the clinical chemistry, random or fasting blood sugar, electrolyte, pregnancy test, urinalysis, wider liver function test, albumin, and glycosylate hemoglobin is also covered under the scheme. But for every test, every investigation, every screening, every X-ray under ILERA, apart from the HIV test, must be medically indicated. Meaning, walking into the hospital and say, I want to know my blood group and my genotype, you will be required to pay out of pocket. But if it is recommended by a doctor, then you will not have to pay. I hope we are all following. This still goes under the screening and investigations aspect, which is in microbiology. Diagnosis for radiological investigation include echocardiogram, as well as plain X-ray, which covers the chest, limb, abdomen, vertebrae, and pelvis. Ultrasound scan is also covered under the scheme, which includes obstetric scan, abdomen USS, as well as pelvis USS, which is covered up to 2 times a year. ILERA covers ECG twice a year, cervical cytology once a year, and then mammogram once a year under the standard general plan. Mind you, we're still talking about the standard JARA plan. So when we get to the other plans, we'll only be talking about the differentials between the JARA plan and the inclusion on those other plans. Still on the secondary care of EKO standard JARA plan, we'll focus more now on the maternal care. And in a summary, EKO covers full maternal care from antenatal to delivery. From antenatal to delivery. However, I will be sharing the benefit package with the organizers of this call so that they can distribute to you. So you have a full breakdown aside from this presentation, because some of these things have some terms and conditions involved. So, but for the antenatal and delivery, it is fully covered. And the delivery covered includes normal delivery, assisted vacuum delivery, as well as CS. Has to do another one. So it's not a case of, oh, I don't want to push, I just want to give birth via CS. That will be really we asked to pay out of pocket. Other services that are covered under the maternal and newborn care include the hysterectomy, experimental laparotomy to indicate the control of postpartum hemorrhage, meaning if the new mom is bleeding after delivery and they need to know why. It also covers immunization and vaccination schedules, circumcision of newborn baby boys, and epilepsy for the baby girls. Now, for the baby, they are covered for the first 28 days of life. This is outside being added to their parents' policy, meaning if a family plan already exists and a newborn baby comes into the family, even before the baby is added to the policy, the baby is covered for the first 28 days of life. That's a month. And what the baby is covered for is incubator care for premature borns, ophthalma neonatorum, phototherapy for jaundice, sepsis, asphyxia, and then neonatal tetanus. Local ambulance will also be available for maternal emergency from one hospital to the other. If a hospital handling a particular delivery is beyond their control and they need to refer the early to a higher facility, either a teaching or a general hospital, then ambulance will be available to transport them. Now, moving to the tertiary aspects of the standard JARA plan, it covers dental care, which is preventive oral health care, the counseling aspect, scaling and polishing once a year, which an enrollee can request for, the non-surgical tooth extraction up to 2, dental x-ray, as well as composite filling. The surgeries under standard JARA plan are broken into two, which is the minor and the major surgeries, which is incision and drainages, bone dressing, heniography, eniotomy, as well as appendectomy, whether it is ruptured or unruptured, lumpectomy. And then the major surgeries include X-lap, as I've already mentioned, whether it is ruptured appendix or unruptured appendix, appendectomy, and then repair of a permit me for another aspect of the tertiary category under the standard JARA plan is the annual medical screening, meaning once a year, an enrollee has access to all these tests under the standard JARA plan. And this has got to do with medical indication, meaning you don't have to see a doctor first before going to do this test. And this is only accessible from the second year. Like I said earlier, there are some terms and conditions that are added to these plans as a policy guide to ensure sustainability of the ILERA scheme. But all these tests are accessible in any of the 43 diagnosis centers that we're currently partnered with. Meaning, if you call us that you want to do your annual medical screening after qualifying for it, then we'll just ask you local government you are, and then we'll tell the diagnosis center to go for such tests. Results after the screening can be taken back to your hospital for further treatment or can be filed for reference purposes. It also covers emergency services for people who need it, as well as telemedicine services, which is accessible 24 hours a day, meaning from the comfort of wherever you are, you can access telemedicine service, speak directly with the doctor, get your prescription, and then go pick it up in any community pharmacies near you. Now, cancer treatment is also covered under the scheme, but the limit is 2 million naira, and it's also accessible only from the second year. Now, the types of cancer are treatment of breast, prostate, cervical, or colorectal cancer, and then Burkitt's lymphoma or retinoblastoma, which is cancer of the eye, and that's for childhood cancer. That speaks a little, this summarizes the quality aspect of the EKO plan. Now, to look a little into the affordability aspect. So, on the standard JARA plan, you can pay as low as 15,000 naira for an individual for a year, 55,000 naira for a family of 4, and then 80,000 naira for the family of 6. Now, the family size can be defined as father, mother with children below 23. So, for the family of 4, it is children, which is still under the category of family of 6, and they pay 80,000 to access all these benefits within the policy year. Now, there are options to pay in installments, but these are reserved for corporate and group registrations. For individuals to pay in installments, they would have to join either our cooperative or have access to the Easy Pay 2.0. We'll be talking a bit about that much later. It's a different slide for that. Now, if we to go into the standard JARA Plus plan, which is an upgrade of the standard JARA plan. The standard JARA Plus plan was initially designed for corporate Lagos, meaning corporate organizations, companies who ask for more and don't mind paying a little more. So we'll be focusing more on the difference between the JARA plan and the JARA Plus plan without repeating all that is covered within the JARA plan. So let's start with the highlights. The things that are highlighted in green is the difference between the JARA plan and the JARA Plus plan. For the number of specialists covered under the JARA plan remains the same, but the number of visits is now extended. For the JARA plan, it was 4 visits. Now for the JARA Plus plan, is 8 visits. For physiotherapy under the JARA plan, it was up to 5 sessions within the policy year. But the JARA Plus plan has up to 10 sessions within the policy year. Any aspect of this presentation, that's the JARA Plus plan, that is not highlighted, it means it is the same thing with the JARA plan, so we don't need to repeat it again. Now, for retention lens and frame under eye care, the JARA plan limit is 10,000 naira, but the JARA Plus plan limit is up to 20,000 naira. So if the glasses they're getting is still within 20,000 naira, then the enrollee won't have to pay anything. But if it exceeds 20,000 naira, they will only pay the differential. But if they go with their frame as recommended or as suggested, they might not need to pay anything at all. Now, for the admission, for the JARA plan is 15 days, but for the JARA Plus plan is 21 days. If you also remember, for the JARA plan, it is standard or general ward. But for the JARA Plus plan, they can access admission in the semi-private ward, depending on how the hospital defines it. But from our end, it is the semi-private ward. The pharmaceutical care, blood transfusion, chronic illnesses, and HIV services remain the same, as well as the TB services, the blood work, the clinical chemistries, they all remain the same. Now, for the ultrasound, for the obstetric scan, the enrollee has 1 extra year outside ANC. That means 1 extra year, 1 extra scan outside ANC. That's within the policy year. And it also covers pap smear, which is once a year for our female enrollees. The maternal and newborn care remain the same, nothing has changed, nothing removed and nothing added. Now for the dental care, the composite filling is now twice a year as against the once a year in the standard JARA plan. The annual wellness screening also remains the same, like I said, which is also accessible from the second continuous year. And the emergency services for the standard JARA Plus plan is now up to 48 hours in the healthcare facilities. For the standard JARA plan, you will only be stabilized, and once stabilized, they will be referred to their own primary hospital. But for the standard JARA Plus plan, they can be stabilized for up to 48 hours in the emergency facility before then referred to their own primary healthcare facility. Now, for the cancer care, for the JARA Plus plan, it is up to 2.5 million naira. The types of cancer remain the same, but the cap has now changed to 2.5 million naira. Now, the premium for the standard Jara Plus plan is 40,000 for an individual, again, 146 for the family of four, and then 220 for the family of six. The Jara Plus plan also has semi-annual for organizations that want to pay installment. That despite the fact that the Jara Plus plan was designed for corporate organizations, this was not restricted to corporate organizations. Private individuals can also buy it if that is what they choose, and they can enjoy all the benefits. The only difference is they will not be able to pay in installments, they'll have to pay annually. Now, the terms and conditions, like I said, will be shared on the platform so everybody can have a time to go through it properly. Now, the third plan will be focused on the seniors plan. The seniors plan was designed basically for residents of Lagos that are outside childbearing ages, meaning age 60 and above. People are only childbearing ages. And for that effect, there's basically one thing that is not covered, which is maternal care. So under the seniors plan, enrollees cannot access maternal care. You hear me? Okay, I'll just go on. So still going about the difference between the Jara plan, Jara Plus plan, and the seniors plan. We'll be focusing again on the differences, which are the things that are highlighted in the green. So for the specialist consultation for the seniors plan, this is limited to 6 visits, while physiotherapy is up to 15 sessions within the policy year. Common ailments remain the same, but for the length and frame, 5,000 within the policy year. There's also an option for home care and medical services, which is a separate payment. Now, admission is now 20 days within the policy. Still available while on admission. Microbiology and radiological investigations, they all remain the same. The ultrasound scan, however, is now abdomen USA twice a year, ECG twice a year, and then pap smear is also added for once a year. Dental care is the same as the Jara Plus plan, meaning dental x-ray is twice a year, composite filling twice a year. Scaling and polishing once a year remains the same and is still available. The types of surgeries available on all our plans remain the same. That is why it is not being added. Now, the major difference between the seniors plan and the previous plans is the maternal care as well as the annual wellness screening. For the annual wellness screening, for the Jara plan and the Jara Plus plan, they can be accessed from the second year. But for the seniors plan, they can be accessed from the first year. Meaning, if I register for ILERA in June 2026, I can access but for the Jara or the Jara Plus plan, you would have to wait till the second year. Also, emergency care includes up to 48 hours stabilization in the healthcare facility, and telemedicine remains the same. For the cancer treatment on the seniors plan, it is also 2.5 million naira limit, and the types of cancer remain the same. And for the premium, it is 60,000 for an individual and 100,000 for a couple. Remember, I said that the seniors plan does not have provision for childbirth or maternal care. So there's no opportunity to add children. As we humorously say at the agency, it's only for grandpas and grandmas. So it's for principal and or couples. But also, like the standard Jara Plus plan, it is not restricted to people within that age bracket. People below 60 can also register for the seniors plan if they so need some of the services provided here. For example, someone needs to access annual wellness screening from the first year,
and does not mind being outside the family, and that buy the seniors plan and enjoy all the benefits involved. So at this point, I would like us to take a little break, and then if we have some questions, we can just write them down, or we can just see them now so that we can go over it. And then we'll talk more about how to access ILERA EKO. Thank you very much.
Thank you so much, Mr. Olusegun Brahima, for such a very wonderful session. So please, if you have questions, that we have a Q&A box where you can just click on to ask your questions, and Mr. Olusegun will attend to them. I can see that there are 2 hands raised. So because of the kind of session this is, you can please drop your question in the Q&A box, and Mr. Olusegun will attend to them. Please kindly drop your questions in the Q&A box. I have Kunle Adelakun and Wasiu Oyedepo. Please kindly drop your questions in the Q&A box, and Mr. Olusegun will attend to it. Waiting for your questions. For those that have questions, please drop your questions in the Q&A box. Okay. So Mr. Olusegun, I have a question here from Wasiu Oyedepo, and is asking, which of the individual plans cover surgery of the nose?
Okay, to answer that directly, there is no surgery there's no plan that covers surgery of the nose. However, we have a specialist care consultation that covers ear, nose, and throat under our specialist care. So you can see a consultant, you can see a specialist, an ENT specialist, but surgery of the nose is not covered under the scheme. This is also an opportunity to reiterate that the ILERA EKO is a social health insurance plan, meaning the aim is to cover as much as possible with as low as possible. So there are some services that may not be available under the ILERA EKO because of its social nature, which also means that is why it is also quite very affordable, so everybody can have access to it.
Okay, thank you for that, Mr. Olusegun. I have a question here from Muri, and it says, I'm over 60 years old and my wife and kids are under 60. What plan should I go for?
So for this is in 2 ways. It is possible to go for the Standard Jara Plus plan, which has a lot more than the Standard Jara plan, depending on the number of kids you have, so you know your premium. And it also, the other part is your own health needs. Your own health needs. So it is possible to have 2 plans. You can have the seniors plan for yourself, while you have any of the other plans, either the Jara plan or the Jara Plus plan for your wife and kids. The only thing is you have different policy numbers. So while you have your own policy number for your plan, your wife and kids will have their own policy number for their plan. And then you can choose your hospital respectively.
Okay. Thank you so for that. I hope that answers your question. I have a question here from Kunle Adelakun, and it says, can these Lagos health facilities use or cover for HMO for small business owners, staff? Okay, I think
Sorry, I didn't
it
get that. Can
means,
you repeat it?
does this cover for small business owner, their staff? As in, do they have cover for staff
Okay.
that work under businesses? Yes.
Yes. So one of the services we render is corporate registration. So it's not just private individuals. Currently, we have to the north of 12,000 organizations that are providing health insurance for their staff members under ILERA EKO. To the north of 12,000 organizations, both small and large, companies with as low as 10 staff, 5 staff, who buy ILERA EKO for their staff members. So yes, we do provide it, and you can also choose any of the plans for your staff members depending on their capacity and their health needs, or according to your organization's policies. I believe that answers your question.
I believe that answers the question. So I have another question here from Olufunke Ereton, and it says, what plan covers delivery and maternity treatment?
So the standard JARA plan and the standard JARA Plus plan are the two plans that cover delivery and maternal care. So we call it maternal and newborn care. So if you are under any of those two plans, you must be registered as a family, not as an individual. If you're registered as an individual, you will not be able to access maternal care, but you have to register as a family under the standard JARA plan or the standard JARA Plus plan for you to access maternal care. And I'll just make a few of the terms and conditions to qualify for that particular service. First of all, for you to qualify for delivery under any of those two plans, you must have accessed 5 months of antenatal care, meaning you must have attended ANC up to 5 months, then the delivery will be covered. I hope we got that. Also, for surgeries, you have to have been on the scheme for up to 4 months before you can access surgeries. And this is to discourage people who come to the facility when it's just a month or 2 months to their delivery. Of the scheme, what actions.
So, Mr. Olusegun, I don't know, we can't really hear you. Are you? It seems your mic is muted.
Can you hear me?
Yes, we can hear you now.
Okay, I only muted the mic when I was done answering the question. But if I have to go over it again, that's fine.
Okay,
I'm
because
saying,
we were breaking up at some point. So, yes, please.
oh, sorry about that. So for the delivery and maternity treatment, you can access it on the standard JARA plan or the standard JARA Plus plan. Both plans have provisions for maternal and delivery, maternity care and delivery. And like I said, there are two conditions. One, to access it, you must be registered as a family, not as an individual. You must be registered as a family. And secondly, you must they would have to pay out of pocket for their delivery, just the delivery. But there's also a workaround for it. Because it's social health insurance, whatever Neroli will be paying at the hospital, even if you have to pay out of pocket for the delivery, will not be the hospital's rate. Rather, it will be the ILERA EKO rate. So let's say you choose a hospital like St. Nicholas, which is one of the hospitals under the ILERA EKO, or Arjolat, or County Hospital. You will not be paying what County would have charged you or what St. Nicholas would have charged you on a regular day if you were just going as an out-of-pocket paying patient. But because you are under ILERA EKO, you will be paying the agreed tariff from ILERA EKO to the hospital, which will still be way lower than what you would have paid if you were not under ILERA EKO. And this is if you have not met the criteria to be covered for delivery in the first place. I believe that answers your questions with a better explanation.
Okay, Madam Olufunke, I hope that answers your question. I have another question here from Nancy Njoku, and she's asking, how do we know the available hospitals on the seniors plan? Please, okay. And how do we sign up? I would like to sign up for my mom who is above 60 and based in Surulere.
Okay, so for the list of hospitals, it's not something I can list out here. We currently have 374 accredited healthcare facilities under ILERA, and this is a mixture of private and government hospitals. Government hospitals including teaching hospital, general hospital, as well as federal medical centers and some health centers. That's some primary healthcare centers. And all this number is still under 70. So we have over 300 private hospitals that you can choose from. The list of hospitals are readily available, which can be shared with you. I don't know if it's permitted for my number to be shared so that these documents can be shared. These are public documents which you can also find on our website to download and then go through it. So you can know which hospitals, and they are categorized into local governments. So you can look at a list and look at your local government to know the hospitals that are closest to you. However, you are not restricted to hospitals in your local government. You can choose any hospital, if whether it's close to where you live, close to where you work, or it's just the one you prefer. There is no restriction really. It's not geo-fenced, but we'll just group them like that for ease of access. And then I think someone was mentioning that they want to register their mom or something like that. I think I heard you saying something like that. Okay, so I'm seeing a question here from Faith Aribisala. Says, how do we change our hospitals if we leave a particular environment to the hospital now close to us? You mean a closer hospital based on proximity? It's as easy as filling the Google form. So we have a Google form that we share with our enrollees who wish to change their hospital. However, you can only change the hospital twice a year. So if you're changing your hospital, the form requires your full name, your phone number, your policy number, the hospital you're changing from, the hospital you're changing to, and why. It's that simple. Hospital you're changing from, hospital you're changing to, and why you're changing. And whatever reason you give us as to why you're changing, we truly take it as feedback so we can know how to further manage and maintain high quality, quality service delivery within the hospitals. So if people are living in a particular hospital based on 4-7, we'll know how to address that. If people are living a particular hospital based on access to care or working hours, then we'll know how to manage that. So the feedback is very important to us. Okay. Someone is also asking, what is registration? Please, is registration pay once or monthly? So if you're registered as an individual, you will have to pay once. When I mean individual, I mean just you or you and your family. That's what I categorize as individual. You would have to pay once, which is once a year. However, we have a few options where you can pay in installments, which is through ILERA Cooperative. That's a cooperative society set up specifically for ILERA or our easy pay options. Our easy pay options. There's a slide to it, and I'm trying to bring it up so if we can see that very quickly. So to join our cooperative, documents to the organizer, so to LSTS, so you can see how to join the cooperative, which enables you to pay in installments. You can even pay monthly, and then you also get to enjoy ILERA EKO. And this is also might just wish to be part of the cooperative, so they can pay monthly and they'll still enjoy under ILERA EKO. But paying directly monthly, that will be possible. The other option to pay in installments is the Easy Pay. We call it the Easy Pay, which we have recently just newly launched, which allows enrollees to pay in installments in whichever modalities they prefer. This uses a mobile wallet technology. So you just pay an amount into the mobile wallet, and once the money is complete to the tune of the premium you're supposed to pay, the system automatically picks the money and then puts you in queue for the activation of your policy. So say, for example, you're registered as family of four, you're supposed to pay 55,000 naira. You can put 5,000 in your wallet today, and then put 2,000 tomorrow, and then put 10,000 the day after. Once the money hits 55,000 naira, the system will pick it and then activate the policy or put it on queue for activation. These plans, this installment payment options, which is the ILERA and the Easy Pay, are also meant to encourage savings and contributions culture, so that you always have money in your wallet, so you won't have to wait till when the policy expires before you start looking for money to renew your plan. Have I answered your question, Ms. Olufunke?
So please, okay, I think Ifenojo Damlare is saying 3 children, husband and wife is how much in a year?
So 3 children and husband and wife in a year depends on the plan. If it is the standard JARA plan, that's 80,000 naira for a year. If it is the standard JARA plus plan, that's 220,000 a year.
Okay, there's a question that says, can we do 3 months or half payments?
So if you want to do 3 months, like you said, which is instrumental payments, or you do the Easy Pay, where you just pay and then when the money is complete, you begin to access it for. Or if you're thinking of paying for 3 months and then use it for 3 months and then stop, that's not an available option under ILERA.
Okay, I think that's all the questions that we have. So please, do we have any more questions before we round off the session for today? Okay, so Mr. Olusegun,
Okay,
they are requesting for the website.
someone just asked for the website.
Yes.
Our website is lashma.com, www.lashma.com. You can also check us on www.ileraeco.com. And we are available on all social media platforms, Instagram, Facebook, X, Thread, and LinkedIn. So you can also, okay, ask me to type it out, that's fine.
Mm. Mm.
So for Faith Arabisala, you asked for every link for registration, change of hospital, onboarding, and accessing the app.
Okay, so Mr. Olusegun, I think we have one more question here that
So I may
says,
not be able to share every link here, but I can share my WhatsApp phone number where you can reach out to me, and then I can just send it to
yes, you
you.
you can do that in the
Or
chat
I can
box
send
so
it to
that
the
they can
organizer.
reach out. Or you can send it, yeah, I can share it with them on the group.
on the chat box so that others can have it.
So it will be shared to the group, the slides, Mr. Olusegun's number, so that for those that will have maybe probably have one or two questions I would like to reach out to him, you can easily do that. Okay, although it has been dropped. So for those that are joining us on our other social media platforms, you can reach out to him on 081 690 18853. That is 081 690 18853. So, Mr. Conley, it has been shared already in the chat box. 081 690 18853. 081 690 18853. For the benefit of those that are not that are joining us on our other social media platforms, I would say that again: 081 690 18853. So you can reach out to Mr. Olusegun via that number. And if you have more questions for him, it will be on hand to attend to you, answer your questions, and attend to every query that you might need as regards ILERA EKO and LASHMA as a whole. So thank you so much, everyone. In the absence of any other questions, I'd like to appreciate every single one of you for staying this long on this session today. I'd like to also appreciate Mr. Olusegun. Thank you so much for taking out time off your busy schedule to attend today's session. We really appreciate you, and we look forward to having you also next month so that you can also take negotiations through everything that has to do with ILERA and what you have on offer. So thank you so much, everyone. We really appreciate you once again. And we'll be having our legal advisory session next week, Tuesday. So be on the lookout for that. And if you also like to know about cybersecurity and how it applies to your business, we also have that next week, Wednesday. So please be on the lookout. We have so many sessions that you will learn from that we have on offer for you next week. So please be on the lookout. Follow us on our social media platforms. And for those that are already on the group, please be on the lookout. We'll be sharing that shortly before the end close of business today so that you can click on the links to apply. So Madam Olufunke, you need a loan, please, you can walk into any of our local government. Our officers will be on ground to attend to you and to help you apply for our loan programs. So thank you so much, everyone. We really appreciate you and we do hope you enjoy the rest of your day. Goodbye, everyone. Thank you so much, Mr. Olusegun.